Dr. Chris Beyrer, an internationally recognized epidemiologist, oversees the Duke Global Health Institute. Recently, he gave me a tour, and I got a chance to talk to him about some of the amazing resources the Institute offers for our faculty and students. Chris, thank you for talking with me today. You're in your second year as leader of the Global Health Institute.
Yeah, it's been wonderful. Thank you.
And I'm sure you've got an idea of what the research priorities are. What excites you most about the research?
Well, Duke has an extraordinary global footprint, and we are doing really cutting-edge research. I think one of the most exciting areas for the Institute right now is the interaction of global health and climate change. And of course, we're working in the Amazon, in East Africa, and Southeast Asia, and some of the world's most affected places. I think the work that's going on with malaria in Kenya, in East Africa, I know you visited there in the past, is really an example. The northern part of the country has been malaria-free historically. It now is seeing an extraordinary increase in malaria, mostly due to a new vector that has come from India, heat-tolerant, and that is spreading in areas where there hasn't been malaria before. So we have the potential to lose malaria control.
Right. It's really very, very unsettling to think about. So Global Health has resources for other people that want to get involved in international work. What would you advise somebody starting their career?
Well, first of all, I would encourage anybody to think about having more of a global health footprint to the work that they do, because it's so deeply gratifying. And I think what people find is that when you get out to low resource settings, your skills and what you have to bring to patients and to public health is so valued. So, and that really is extraordinary. But here at the Duke Global Health Institute, we have an infrastructure that supports people who want to do that. So we have a fantastic data and design core, the research design analysis core. We have a very strong group that manages international grants, contracts, so it facilitates people's research. And I think more than anything else, we have a very large cadre of Duke faculty, students, and staff who are totally committed to this idea of global health equity.
And you obviously made the decision in your career many years ago. What helped you to really jumpstart that career?
I think if you look at many of the people who work globally, you'll see that they had an early formative experience in a developing country. My own was spending my senior year in college in Sri Lanka, a country I just was able to go back to, where Duke is doing really important work on a new climate-related disease, chronic kidney disease of unknown origin. I realized in that time, this is so exciting and so interesting, and that I wanted to make working globally a part of my career, and I never have not done that.
Well, speaking of students, obviously early experiences can influence your whole career. So what does the Institute offer for students and trainees that want to do something international?
Well, we have a number of options. Of course, we have a master's in global health, which is the degree that we grant. We do have third-year medical students who have that research year rotating and spending time in our international partnerships in East Africa and in South America and in Asia. But we also, Duke has a really unique program which is housed in the Hubert Yergin Center. That's a sister center of our institute. And that's a global health pathway where residents can do their training in global health. They get a research year overseas and the master's in global health. And that is really a unique program. And many of our strongest faculty, Catherine Staten in emergency medicine, Jerry Bloomfeld in cardiology, have come through that pathway. Jerry's a great example. He is a cardiologist. He works in Durham, but he did the global health pathway. He developed relationships in Kenya, and now he's very much an active researcher in cardiology in Kenya. And Duke has worked with Moy University to build a fellowship program there, and our lead now for cardiology in Kenya is a Kenyan, and that was always the plan.
Yes. Well, I can tell you, as being chair of medicine, having that opportunity for residents coming here was a big draw.
Yes.
So it really helped build that base of people interested. So Chris, if you could pick one memorable experience in your years of working internationally, what would it be?
I think probably for me, one of the most memorable was really seeing the introduction of antivirals for HIV in countries where I'd worked for many years and there was no effective therapy. Many people had that experience. We called it the Lazarus effect. I got to see it in Thailand, and it was amazing.
Chris, your passion is contagious, and I'm excited to be working with you.
I'm delighted to be here, Mary, and your leadership has been so extraordinary, and it's deeply appreciated.